Let's talk a little about cholesterol, because cholesterol is another number that people are obsessed with. In fact, a lot of my patients ask me to check cholesterol just because they want to know what it is. They have no intention of treating it. I've had people say they want to know their cholesterol level because they like to talk about it around the dinner table. Everyone wants to tell everyone else their cholesterol level. There was a time back in the 50s and 60s where people studied cholesterol and created this link between high cholesterol and heart disease. And that link was perpetuated by things like the Framingham study and the Mr. Fifth study. But in fact, as people are going back and looking at those studies, that link is very weak. In fact, people in countries that consume the highest level of cholesterol and fatty foods live the longest. The countries that consume the least amount of fatty foods die earlier. People have a lower life expectancy. Probably the reason for that is that the countries that consume the most fat are the most advanced industrial countries and have better health care and better public health. So it has nothing to do with cholesterol. But we do know that there seems to be a correlation with people who eat the most fat live longest. Well, they did a recent study looking at all people who came in with heart attacks over the course of many years at many centers, and it was a scattergram. People had low cholesterol, people had high cholesterol, people had cholesterol in the middle. Cholesterol seemed to have no impact on whether you're going to have a heart attack. It has no impact on whether you're going to die. And the amount of cholesterol you eat has absolutely no impact on your own body's cholesterol. The body makes its own cholesterol. So you could have cholesterol all day. You could eat eggs and other things high in cholesterol. It's not going to impact your cholesterol. And in fact, eggs are a very good food, loaded with antioxidants. So cholesterol is a number that has very questionable meaning. We know that certain medicines that lower cholesterol do not change your heart attack risk. So just measuring that number and figuring out if it's high or low doesn't really tell you whether you're going to be healthy or not, or whether you're going to get a heart attack. So the question is, why do we do it so much? Well, there is this theory that if you lower cholesterol with statin cholesterol medicines, medicines like Lipitor, Crestor, Pravachol, that you'll reduce your risk of heart attack. And there are some studies that suggest in people who have had heart attacks or strokes or are at high risk for those, such as people with diabetes, that going on statin medicines will actually improve your risk of preventing a heart attack or stroke. But that risk is small. Sometimes it's measured in hours in terms of life saved. In other words, people on the medicine might live a few hours longer than people not on the medicine. We don't know that going on these medicines actually lets you live longer in most cases. Even if you do prevent a heart attack, it's typically a non-fatal heart attack. So these medicines have a tiny impact, if any at all. And statins are the only medicine that have been shown to have any impact in that certain select group of people. And it's tiny. The relative risk, which we've talked about in the blog, might be higher than the absolute risk. The absolute risk being probably less than 1% in most cases. So what's the danger of taking statins? What's the problem with them? Well, statins definitely have side effects. The biggest side effect in the elderly is muscle weakness. If you look at my own example, I actually took statins for a year because my cholesterol shot up, and I didn't have any classic symptoms, but I'm a runner. And during that year, I just could not run. I had to be picked up in some of my long runs, and I had my worst marathon time in 20 years. The following year, when I was off the cholesterol medicines, I had my best marathon time. No other changes other than the cholesterol medicine. That was a subtle change, and I see that all the time in the elderly. People cannot walk as well. They're weaker. They fall more. A lot of this is not measured. We don't have studies showing this, but it's an observation that many of us in geriatrics have seen. So I often take people off their cholesterol medicines just to see if they improve, knowing that the risk is not going to be very high of removing them from these medicines. So cholesterol, people ask me every year, check the cholesterol. Do we really have to be doing that? What's the point of this number? The Medicare guidelines are very adamant. People with diabetes or other risk factors need to have their cholesterol checked and need to have it treated if it's over a certain number. But there is no good science behind that. Once again, Medicare is pushing us down a road of aggressive care that actually can cause more harm than good. In aggregate, for many, many older people, it's really not important to check cholesterol, and it's probably best to avoid treating it if it's high. It's just another part of that number obsession we have that causes more harm than good.